Well, Dr. Amen joins us now via Skype, so we've got our social distance down. I'm hearing a warning that suicides would rise if we keep the country shut down. Do you agree with that?
Well, I do, but it doesn't mean we won't shut the country down because the death from this virus is already devastating. What we need to do is help people with mental hygiene. Everybody's going after Lysol and disinfecting wipes, but very few people are actually talking about how to manage your mind during this very difficult time. And the incidence of suicide before this happened had risen to really epidemic levels, especially in teenagers, because no one's really teaching people how to have a better brain and a better mind.
So teach us, tell us how do you have and how do you practice good mental hygiene?
Well, so the first thing is we have to realize is the mind is created by the brain. Get your brain right and your mind will follow. So really falling in love with your brain and doing the right things for it, especially sleep. People who sleep less than 6 hours a night, which is very common now with all the worries going on, they have lower blood flow to their brain, which means they're going to make more bad decisions. And so making sleep a priority is absolutely critical. And then exercising as you can is really important. But what I teach people is how not to believe every stupid thing they think. I call it killing the ants, the automatic negative thoughts that just come into your mind and steal it. And the Apostle Paul said, think on whatever is true, right, lovely, good, excellent, worthy of praise. He's really talking about how to manage your mind, which is just critical during this time.
How do you maintain good sleep? I'll just talk about what I experienced just last night. I'm in the middle of some bad dreams, and I've learned how to wake myself up out of the bad dreams, but it just kept coming back. And so I was having a really restless night where I'm waking myself up saying, you are in charge of this dream, stop this, but it kept coming back. How do we make sure that we're going to have good sleep throughout the night?
Well, I'm gonna give you a secret I give my patients. Whenever you have a repetitive negative dream, before you go to bed, finish it. Like, give it a different ending where ultimately the author of everything that goes on. And sleep in general, if you want to love it, I mean, care about it, avoid things that hurt it. So alcohol at night, caffeine during the day, too much light, gadgets, you have to like start turning off the gadgets when it becomes dark because the blue light goes into your brain and turns off the production of melatonin, which tells you to go to sleep. So care about it, avoid things that hurt it, and then do things that really promote sleep. So get into the right rhythm where you're relaxing yourself before bed. And I often say, it's okay to read before bed. Just don't read something that's stimulating and exciting. Read something you want to learn, but you're not all that interested in it.
All right. I know that we're very social animals. People like to socialize. People like human touch. What do you recommend for people that are socially isolated that aren't sheltering in place with family? What should they be thinking about? How can they replace that?
So they just need to remember there's going to be an end to this, and the end to this is going to come quicker than most people think. I was an Army psychiatrist for 7 years, so I understand about isolation and being deployed. And what you really get in the habit of just sort of counting the days. And because we know we're going to be at home at least to the end of April, and for most of us to the end of May, that, well, what's the goal? What do you want to accomplish in this month or 2 months? And really become goal-oriented to get something done. People can get healthy during a pandemic because, quite frankly, we have more time now than we have had in decades.
Well, let's talk about teenagers. I know a lot of families are having teenagers at home, and I remember my teen years a long time ago, but I remember I had a lot of energy. How do we help teenagers today?
So the first thing you do is you model good mental health practices, because kids are like violins. They play the stress of their parents. So as parents, we have to model calm, clean thoughts, accurate thinking rather than catastrophic thinking. And then you want to really work on your relationship with your teenager. In my house, I have a 10-year-old, 15-year-old, and a 16-year-old. And quite frankly, the silver lining in this is we have more time with the kids than ever. And so good discussions, bonding, being a good listener, all of that will help. And then monitor their social media and the habits they're doing that either drive anxiety or help drive peace.
All right, anything you recommend for helping us build up our immune systems, and anything more for our mental health?
Well, so there's this great book that was written, I think, 1979 by Norman Cousins, called The Anatomy of an Illness. And I talk about it in my book, The End of Mental Illness. If you want to boost your immunity, what he did, he had a very severe autoimmune disorder. None of the meds were working. He locked himself in a room with comedies for 500 hours. And at the end, his illness was dramatically better. So don't watch Contagion. It's the wrong thing to do. Find movies that you love, that make you smile, that make you laugh. That can be helpful. Plus, you have to optimize your vitamin D level. I tell all of my patients, take somewhere between 2,000 and 5,000 units a day. Eat garlic, mushrooms, onions. They help boost our immunity. And then vitamin C can also be very helpful during this time.
All right, well, that's great advice. Laughter is very good medicine. Thanks for being with us. The book is called The End of Mental Illness. It's available now wherever books are sold. And Dr. Heyman, thank you for joining us.